Hey moms and dads, welcome to your webinar on colic and reflux. And I know if you're watching this webinar, there's a good chance your kiddo is struggling as a newborn baby and having some pretty intense moments. And I remember when my son was first born, and the very first night he was born in the morning about 6 a.m. And that night we're trying to settle in and see what was going to happen for bedtime. And he had this stretch of just crying for 2 hours straight, and mom and I were passing him back and forth. We're trying different positions, and we hit this point where we looked at each other like, whoa, this is what parents deal with night after night. And it took a bit to help him get through things. I'll share more here as we go along. But it was incredibly challenging because as a parent, especially with a newborn baby in that situation, like all I wanted to do was to be able to help. And whether your kiddo is early on in life, whether they're a few months old, whether they're, later, closer to toddlerhood, we want to be able to help you. So this webinar is going to talk about like what is happening, what should normally be happening, what can get in the way of normal, and how to help. If you don't know me, my name is Dr. Ty. I own Whole Family Chiropractic, and we focus on kiddos and families with a very gentle neurological style of chiropractic, ultimately trying to get to the root of health problems and help you and your family not only get over things, but to express as much health and as much life as possible. I actually, fast forward a couple weeks after my son was born, had been out of the office, and I'd come into the office for my first shift as a father, and the new patient we had that afternoon happened to be also a newborn baby. She was 10 days old and was dealing with extreme reflux. So much so when she was two days old in the hospital yet, she had been having a lot of reflux, a lot of spit up, and all of a sudden there was a point where mom and dad look over and she had turned blue because she had so much that had come up and she wasn't able to swallow. She was asphyxiating, and they had to have the nurses and the doc come in and resuscitate her. And it was intense to hear them tell that story, but even more intense to hear that as a new father at the time, thinking, wow, I couldn't wish that upon any parent or imagine having to go through that myself. So I know, as I said, if you're listening to this webinar, there's a good chance you've had those late nights, you've had the witching hour where you don't know why your kiddo is crying so much or why they're so mad or frustrated or uncomfortable, and all you want to do is help. Or you're trying to get them good food and good nourishment, and it just is coming right back up. So whether they're uncomfortable and not keeping food down, we've dealt with babies in our office that have had failure to thrive because of how intense things were. I want to know that we're going to, in this webinar, give you some hope and give you some help and give you some answers. I will say that what this webinar doesn't cover is more tips and tactics and strategies to try to do something a little different, because I know that if you're watching this, odds are you've searched through Google, you've talked to friends and family, you've watched videos on YouTube, you've tried so many things. You've tried pumping their legs a certain way, you've tried the right direction of the circles for tummy massage, maybe you've tried reflux meds, maybe you've tried a wedge or different sleeping positions, different formulas, and different burping techniques. You've taken food out of your diet if you're a mom and you're nursing. So what this isn't a webinar about is a new fancier way to bicycle their legs, but instead it's about taking a step back and saying like, why is my child struggling? Why are they in just this extreme state when they're a newborn baby? Life should be going pretty easy right now. And the bigger question I want to talk about today is, why is your kiddo struggling with something that should come pretty easily, right? Babies are meant to eat, sleep, poop, right? If those things aren't happening, why is that? And a lot of parents that we see become frustrated, and their parental instinct sort of kicks in and takes over when they just hear, oh, some babies are that way, don't worry about it. Oh, he'll outgrow it, no need to worry. Right? But if you're watching this as a mom or a dad and your gut instinct is saying, yeah, it doesn't feel right, it doesn't sit right, that's what I want to talk about today. So as we jump in here, We're going to talk about what normal should be and what can get in the way, and then what you can do to help. And especially, we're going to talk about the brain, the nervous system, things that can be happening during labor or delivery that might be throwing your kiddo off and leading to his or her concerns. So when we are going through today too, if something resonates and you want to reach out to our office, we would absolutely love to be able to help and take care of you and see what we can do to get your kiddo on the right track. If you're not in the Twin Cities, a while ago I was doing a seminar, and grandmother reached out to me afterwards. She's like, hey, my grandson's in Montana and he's 6 weeks old. He's actually struggling with reflux. They're trying a lot of different meds. He's sleeping on this wedge. Mom wants to do this surgery where they cut the bottom of his stomach, a certain valve there, but they can't get into that yet. He's in this failure to thrive category. He's not gaining weight. And so I looked through my contacts, my resources, other chiropractors that I know that work with kiddos, was able to find him someone amazing in Montana. And mom messages me a little bit later. He's weaning off, like after his first adjustment, he started weaning off his reflux meds. He's starting to gain weight. She sent me some pictures, like he's actually thriving now, and he's a happy, comfy baby instead of crying all day long. So just as you watch this too, if you're not in the Twin Cities and you want to get some help, still reach out and we can find you a great practitioner, chiropractor in your area. So we're going to jump in then to what should be happening, and looking at from a digestive standpoint here, since a lot of times colic and reflux, they go together. Obviously the colic piece is if there's lots of crying, and there's different measures and metrics of it's this many hours, this many days a week for this many weeks. And I think the bigger picture of what we look at in our office is less about like, okay, it's that specific diagnosis, but again, that step back, like, why isn't your baby just comfortable to begin with? Why, when they eat, are they not keeping food down? Why isn't their body able to digest food and move it through normally? So in that respect, we're looking here at the digestive system. We know that there's 3 main floors that digestion needs to do when food comes in. So first it comes in the mouth, it goes down, this is the esophagus, the food tube, and brings it into the stomach. So that upper floor, the responsibility is to get it in and get it to the next level. The middle floor, the stomach area, is what's breaking it up, releasing a lot of digestive enzymes and starting to just further break things down in order to get it ready to leave the stomach. And then the lower floor is when it's passing through the small intestine and the large intestine here. That's where the body is absorbing a lot of nutrients as well as eliminating what it doesn't need and moving it through. So if we see challenges in that upper floor, a lot of times as an infant, we might see things with nursing. Maybe they're favoring one side over the other. They're not able to like get things moving and down. If we see challenges in that middle floor, that's where that reflux can come in. I'll talk about that here next. And then the lower floor tends to be, maybe it's gassy, constipated, not getting things moving through cleanly on the other end. So if we go back to colic and reflux, we're going to jump in here, is where these 2 floors meet, the upper floor and the middle floor. That's one of the most common challenging points. And then also actually where this middle floor transitions to the lower floor. So what normally should happen is food is coming in through the esophagus, food goes into the stomach releases lots of acids to help break it down and digestive enzymes, and there's this valve here, this lower esophageal sphincter, that we want to be closed while the body's digesting to keep that food in. And what happens is once it's broken down enough, then this lower level, there's this pyloric sphincter, pyloric valve, that opens up to release it and let it move on out to the intestine and continue through digestion. So that pyloric sphincter was the little kiddo that I just mentioned that was 6 weeks old, that mom wanted to do a surgery where they would actually go in and cut this valve so it wouldn't shut so tightly. What happens is that when they cut that, it helps this food empty and move, and it's less likely that it's going to go back up the other way. So from a reflux standpoint, this valve can commonly be involved, And then this top valve can commonly be involved as well, because if that one opens back up, there too, food's going to come back up the other way. So what should be happening is that food goes in, it breaks it up, and it moves it on, and you just have this nice steady progress of kind of like food going down a conveyor belt, moving through your kiddo's body and digesting smoothly. So what can get in the way then is if those floors aren't each doing their own job. And as I said, based on what your kiddo's experiencing, a lot of times we can hone it in to say, okay, which category isn't doing what it's supposed to do? And rather than saying, okay, well, here's all the ways you have to burp differently or hold your kiddo differently or feed in this order or at this time, we want to be able to help your kiddo do what it's designed to naturally do and take the ease off of you as a parent, because we know that, like with a infant, a newborn at home, it's a lot of work. It's more than what we're used to on a day-to-day basis, but it also shouldn't be like take all your energy and effort just to get a few moments of relief from your kiddo during the day. We want your job to be easier. So next up then, we want to go and say, what can go wrong in this situation? What can affect these valves? What can affect the stomach? What can affect the esophagus and the rest of the digestive tract? In that case then, we're going to look at the nervous system. We know that the body, the different parts of the body, they don't work on their own. For example, if you've ever felt your heart race, it's because your brain sends a message that goes down your spine and out these nerves to tell your heart how fast to beat. Nothing in your body part just randomly does things. Your body is very smart. So we talked about that valve at the top of the stomach. If I go to my stomach here, when that food's coming down and it hits that valve wants to tighten. The good news is your body is smart enough, and your kiddo's body is smart enough not just to have that valve tight all day long, because if it was, the food that was going down wouldn't even be able to get into the stomach in the first place. So that's an example of your brain is coordinating in your body what to do and when to do it. Same with the valve at the bottom of the stomach. If that was just wide open, food would move straight through into the intestine before it even had a chance to be broken down, and the stomach wouldn't be given the chance to do its job. So if we go back to what's coordinating the digestive system, we have in this picture here, we've got your stomach and the intestine down low here, and there's different digestive glands like the gallbladder, the pancreas. They will assist with some of the digestive enzymes to help break things down easier. But we know the stomach has that top and the bottom like we talked about. And if we trace these nerves back, there's this nerve here. It's called the greater splanchnic nerve. Not to worry about the technicalities, but more importantly to notice, where does it come from? Well, the brain, to get a message down to the stomach, these nerves that go down the spinal cord leave these different areas here to get to the stomach. If we go even further down, there's this nerve that goes to the intestine, this nerve here that goes to the intestine. And basically, if you look through the anatomy book, you can find whatever body part you want and trace back to where a nerve comes from in the spine to control that body part. The other piece, you'll see this nerve in green, and I'll mention this one because it's also one of the most common areas that we'll see for colic and reflux. This nerve, it's called the vagus nerve, and that might show up very small on your screen, but the vagus nerve also goes to the stomach, and if you see in green here, it goes all the way down to the intestine as well. That nerve helps control digestion, and it's also a key nerve that helps our brain feel calm and feel grounded and feel balanced. So if that nerve is off, we have a hard time shutting down our stress response. So as a newborn baby or an infant with colic, if they feel that they get, like you feel them get amped up and you can't, you're rocking them, you're petting them, you're wrapping them, you're swaddling them, you're shushing them, you're doing all the things you can do, and you just feel like you can't turn off that stress response, a lot of times what we'll see is it's because that vagus nerve here coming from the upper neck isn't able to regulate the calm side of the nervous system and help to calm and ground things. Another way to look at this, I'll show you here, is through a chart that we use in our office that we call the fuse box chart. And basically what we're looking at here is that upper neck, as I said, that's that vagus nerve. If that's off, digestion's in that category. Colic shows up there, stress shows up there, reflux, GERD shows up, difficulty sleeping shows up there. These nerves here, again, coming from that last picture, that's that esophagus, upper GI, reflux can show up there. And then that major nerve that I mentioned, that splanchnic nerve, the greater splanchnic nerve, goes to the stomach. Indigestion, heartburn, stomach pains can show up there as well. So the reason I'm emphasizing the nervous system in this webinar is that if you've tried all the other things, often this is the missing piece. And it's the missing piece because traditionally you're not taught to look for it as a parent, and it's not necessarily like in the mainstream healthcare model to look for these things. The mainstream healthcare model tends to be look for the symptom, from that get a diagnosis, and from that give a medication to try to decrease the symptoms. So what we look for in our office is how well the brain is getting a message to these body parts, and if there's any stress on those nerves, that's where these different symptoms can show up. Where does that come from then? So if I go back to the spine, we know that the spine is where all these nerves leave, which means the spine needs to be in good alignment in order for the brain to get those good messages down to the body. So I will show you here another picture of what we do to then measure that in the body. And actually, before I go into that, I'll explain how does something get thrown off in the first place. You might be wondering, like, well, my kiddo, they're 3 months old, they haven't had decades of stress as an adult working all the time, or they're not even in school yet. Typically what we see with infants is it's sometimes a stress during the pregnancy. For example, we had twins that came in, and the one that was on the bottom for the last trimester, mom said, once they hit that third trimester with twins in my belly, there wasn't much room for them to move. And the one that was on the bottom got stuck a certain way, and she came out and her head was tilted when she came out the same way she had been stuck in mom's belly. When my wife was pregnant, at 8 months pregnant, she fell and broke her ankle enough that she needed a couple plates put in, so she had to go under some anesthesia and surgery. And after that, of course, wasn't nearly as mobile as she normally was, so her pelvis was in a certain position that it would tend to be almost stuck a certain way. That wasn't letting our son Mason move around as much because, again, she had to have her foot up for a lot of that last month of pregnancy. So during pregnancy and then the labor and delivery is the other big piece that we'll see. In order for a baby to be pushed out of the birth canal, and as they're helping wiggle themselves out, it's 60, 70, 80, 90 pounds of pressure on a newborn baby's head and neck as they're being born and pushed through the birth canal. That's a lot of pressure. If things are going smoothly, we've checked babies after a really smooth birth, and even then things are out of alignment in that upper neck because of simply that amount of pressure. Now, if you were to add a long labor, difficult delivery, if they had to use suction or forceps, or maybe baby was stuck a certain way for a while and they had to kind of go in and pull the shoulder through or help assist things, those can all throw something out of alignment. In our son's case, the labor was 30 hours, and part of that being because of my wife's injury previously, pelvis wasn't quite where in as smooth of motion as it had been prior to that injury because of how much sitting she had to do. So now we have a 30-hour labor, and my son came out, in his case, his head bones were really smushed. And it's, common for a baby to have their cranial bones off as they're recently born, but my son's was very exaggerated. So that put a lot of extra strain on his brain, his nervous system, and his body. He also, his collarbone, we're pretty sure was broken based on this little bump that developed. And when we moved it, he had that like extreme crying and pain in certain positions that happened. That was pretty frequent for those first couple weeks. So very intense labor and delivery, and as a result, a lot of stress on our son's body. So what happens then is if that stress has been put into the body and it's stored up and it's not able to leave, that leads to stress on the nervous system, which can affect digestion and reflux, but it also makes baby just not feel comfortable. And that's where we want to help. So as I mentioned, I'll go over next here, what do we look for then in the body? This is an example of a scan that was done on a 4.5-month-old boy who had extreme reflux, projectile vomiting. Mom said pretty much everything I put in, he's gonna like projectile it back up, not just like spit it up a little bit, but very intense. And in his case, what we're looking for this is an example of the brain sending messages down the body. All these bars are different nerve channels that are taking a message out to the different parts of the body. We want to see white. If we see green is mild, blue is moderate, and red is severe if there's any stress on those nerves. So for example, the stress here, T3 goes to the lungs. That was getting a clear message out. As we see some of the stress in this area, especially I'll highlight the red, that was into the intestine, and also right at this point is where that stomach is emptying things. So now that message going out to that valve, the pyloric valve in that case, pyloric sphincter, instead of getting a clear message out, that message was under stress. The other thing you'll notice here is that upper neck being affected, which if we go back here, that is that vagus nerve, which brings the messages very strongly into the digestive tract. So when we did his scans, not only were we able to feel how the alignment was along his body and feel the tension in his body, as we're trained to do, and as we've seen a lot of kids over the years, but the scans really help us verify that there was stress on his nervous system affecting his brain's ability to regulate his digestion and regulate the calming response in his body and regulate his ability to work normally the way he was supposed to. The nice thing with those scans, it's a thermal scan, so it's just measuring temperature along the spine, and nothing has to go in your child. We don't have to do any blood draws to take anything out. It's no x-rays or no radiation. We do it on newborns and pregnant women all the time because it's so safe. So once we saw what was going on, we were able to put a plan together to help. And after his first adjustment, which also I'll add is very gentle, especially with infants, it's often just a gentle tapping, almost as if you had a tomato that was really ripe and you just want to see, is that tomato ready to eat or not? And you didn't want to bruise it or puncture the skin, you just do a gentle push. Same thing with an infant adjustment. So in this 4.5-month-old situation, first adjustment, called mom to check in a couple days later, and she said he's doing well. So I checked in a little bit later. She said it turned out that after his first adjustment, he went 3 days without throwing up. And actually, I want to back up a little bit for this story. They had done the pyloric stenosis surgery. They had gone in where that valve was and cut it because they wanted to try to get things to empty easier. If we go back here, they had cut that and tried to get the stomach to empty better. Mom said that after they did that surgery, it had gone from projectile vomiting to just like regular throwing up. So the good news is once we started adjusting him, and it took more than one adjustment to help his nervous system fully heal and get back on track. But the good news is mom could see the results. She knew she was on the right track, and it was going beyond just a medication or a surgery to try to, in a sense, cover up something that was supposed to be working normally. So if this resonates with you at all, I want you to know that we love helping kiddos and we love helping their bodies work the way they're supposed to work. And rather than looking for another something you can do from the outside, we want to say, let's look on the inside. Let's do those scans to see if there's anything interfering or stressing with your kiddo's nervous system that then is impacting their digestion or preventing them from getting back into a calm state after they have a cry or a tough moment, as all kids do. So if you are interested, please reach out, shoot us a message, let us know, like, hey, yeah, I did actually have a pretty stressful labor, or these things maybe started even earlier than that, and know that we're here to help.